does.
Thank you. Thank you for your questions. I'll start with the last question concerning the people who escaped from quarantine and the numbers that are being tracked. This issue is being handled by a multidisciplinary team led by our security personnel, and they continue to be able to identify any who they may not have gotten to this point. You're alluding to the idea that the escapees may be the ones who are transmitting this disease, perhaps would not be correct. Again, like I mentioned yesterday, contact tracing is a scientific methodology, and we've clearly repeated several times we have already established community transmission in the country. And so what remains then in terms of mitigating is to ensure that, one, we are maintaining our containment measures, and two, we're ensuring that our contact tracing mechanisms remain to be robust. And that's exactly where we are putting our resources right now and our efforts. With regard to fumigation, we do have several teams across the country who are conducting fumigation, both here in Nairobi County and all the other 46 counties. And indeed, all these teams will be facilitated accordingly and in due time. We've not received any official complaint from any of those members concerning the fumigation, practice in terms of any challenges that they may be facing. But please rest assured, all teams will be deployed, and especially deploying from the Ministry of Health. There's a formal process of deployment, and that process is attached, of course, to ensuring that these people are facilitated accordingly. And we will stand by our word in ensuring that that facilitation is effected. Regarding the quarantine sites, we have a question from Nasibo. When we encourage people to come in for testing, and yet there's quarantine costs attached to this. One thing that we must be clear of is that at the end of the day, we are in the middle of a pandemic. And in this pandemic, the world over, best practice tells us that we should test, isolate, treat, and trace. And we've mentioned that this is the approach that Kenya is also adopting. And so testing is at the center of this. We do appreciate that there may be discomfort in terms of Kenyans coming forward in terms of testing. And we're trying to put in place mechanisms that, one, will remove stigma from the testing practice, and two, that will actually facilitate Kenyans who may not afford quarantine services to be able to undergo a social assessment and be able to get the care that they require. So this is an issue that I'm calling on all Kenyans who are there today listening to this briefing. Do come forward for testing. The government is doing this because we are trying to contain a pandemic, and keeping away and shying away from testing is actually to the detriment of your own health and that of your family. With regard to the question on quarantine and the centers that we have available so far, this is a figure that keeps changing from time to time. As it stands, by the report we have today in Nairobi, we've closed down about 35 quarantine centers, and we have about 219 personnel in quarantine. Again, remember, it's a dynamic process. We have incoming clients who are admitted into quarantine, and then we have clients who are discharged. We do also have a breakdown of quarantine centers across the country, and I'll ask the DG to speak to this number, always remembering that it is quite a dynamic process. People are coming in, they're admitted, they're tested. Once they turn negative, they're discharged. So it's a very dynamic figure, but we do have that available for you. Perhaps one thing that I would want to emphasize today, and I think you would all bear me witness, those who've come in today, the road right down through Cathedral Road, there's a lot of traffic there today. So what this tells us is that it seems that, at least in Nairobi, we've all gone back to normal status. Yet, if you've listened, over the past 3 days, we've been announcing figures in terms of double digits. Yesterday was 30, the day before was around 20, and today is 25. And I hazard to say that this figure will continue to increase. So what we're trying to say is things have not gone back to normal. And I'd really, really request you, members of the Fourth Estate, to partner with us in passing this message. Things are not back to normal. And we do not want to see a situation as we've witnessed in different countries across Europe. So we still need to maintain these containment measures. They're not for fun. They're not for play. It's not child's play. Things are not back to normal. In hotels, we've done spot checks over the weekend. Just yesterday, there's crowding in hotels. People lining up, people banding together near cashiers. Things are not back to normal. And we need to remind ourselves of the pictures we were seeing in February and March across the world and ask ourselves, do we really think or do we really want Kenya to have that experience? And if we don't, then you as a citizen, you have responsibility. So be responsible. Things are not back to normal. Did you kindly add on to this? we'll add on to that.
Thank you, Madam CS. Regarding the healthcare workers who issued a strike notice, we are in discussions with them. And you remember His Excellency the President pronounced himself on the welfare of healthcare workers. And the Ministry has worked very closely with the Public Service Commission, Salaries and Remuneration Commission, and we have developed a plan which is awaiting approval before it can officially be shared with the healthcare workers, especially to cater for their welfare and also to cater for the other other needs regarding the extra hours that they put as we term the COVID-19 pandemic. For the quarantine sites, of course, this number is likely to go up again. Remember, we have started evacuating Kenyans who are stranded all over the world, including Europe, Asia, and also Kenyans who had gone for treatment, especially in India, who are destined to come back home this week. For those, of course, we have to put in place quarantine facilities to be able to accommodate them for the 14 days that they are supposed to undergo a quarantine process. So as Madam CS said, this is a dynamic figure. It is very difficult to point out what the numbers are because quite a number of people come in as others go out. Thank you.
Yeah, more questions?
No, not repeaters.
Curfew violators, up to now, you said that, okay, the AG, Inspector General is actually going to provide spaces for such people. Where particularly, and what really prompted the government to do so, even after saying that, okay, there will be a quarantine in government facilities. And then another question is pertaining to the scientific or the research over the new medication, or the medication of COVID-19. Quite a number of countries across Africa, particularly Madagascar.
Yeah.
Madagascar has actually tried to come up with a...
Sorry, I can't hear you. Louder, please.
Some countries in Africa have actually also tried through their research to come up with a medication of COVID-19, particularly Madagascar. Maybe as a country, how far is Cambridge in their research in terms of identification of the new medicine for COVID-19?
Opportunity. I have a set of 3 questions. One is about what is the situation in refugee camps, and 2, what about how are you handling cases that involve children, and number 3, we had the issue of allowances that other healthcare workers claim that government has decided to only give doctors and not the other cadres. Thank you.
Okay, thank you. I think I'll start with the question regarding the curfew violation. I think yesterday, after the NERC meeting, Kas Rashid was able to share instructions to the IG on how we would avoid the use of quarantine facilities for holding curfew offenders. One, I'd like to report that the report we're getting back from the IG is that, in fact, Kenyans, fewer and fewer Kenyans are violating curfew, and so the numbers are reducing. And number 2, to remember that, 1, quarantine is a public health intervention. Quarantine is not supposed to be a punishment, and therefore that is why that deliberation and position was attained yesterday. And so going forward, I'm aware that the IG and his team are working on ways in which they'll be able to contain curfew violators, and this will also include perhaps a judiciary process, and this shall be shared with you in the coming days. Concerning countries in Africa who are looking at different modalities, I think the DG, the last time we were here, was able to elaborate on different trials that are going on across the country. He gave good information on the drug that was under approval in America through the FDA. And yes, of course, we've heard of the different cures from Africa, Madagascar, and the different countries who have different medicinal products. What we're doing is that through KEMRI and through established systems and protocols within the country, there are mechanisms in which to look and evaluate. Of course, we promote Africa and ingenuity and innovation in Africa, and that is something that requires to be celebrated. However, it's important that that celebration occurs under protocols and guidelines through which such drugs have been evaluated, especially for safety. Remember, at the end of the day, a drug comes into your body. It does something in terms of curing, but drugs also have side effects, and therefore there has to be a rigorous protocol put in place to evaluate this. DG will speak more on the different clinical trials that are underway in the country and those that we foresee in the coming future. Regarding the situation in refugee camps, we are working collaboratively with different agencies and government MDAs who work and ensure that refugee camps are well manned. We have seen, and I think this was highlighted in one of the past statements, that there may be challenges in some camps, but these are being addressed, especially with collaboration from our UN partners to ensure that conditions there are safe and that also containment measures are met in those camps. And perhaps in the next few weeks, we might be able to give you a detailed report as to how we're doing that. Regarding handling of children, there are different teams within the ministry, particularly the case management team that is looking at protocols. How should we deal with COVID in children? The Kenya Pediatric Association, in fact, has had several engagements with us, have looked at our protocols and given specifications and considerations for children. And the same has been done for different conditions. For example, how do you deal with COVID in surgery? How do you deal with COVID in maternity? How do you deal with COVID with a mother who's pregnant? There are all these different variations in medicine. What happens when you have to undergo dialysis and you're COVID positive? All these are things that we've put into consideration, and there are all protocols available. And again, the DG will be able to speak to this. Concerning I think there was a last question on allowances, and this has again had been reiterated and confirmed by DG that teams are looking to see and to ensure that all health cadres are able to get a welfare package that meets the kind of risks that they're putting themselves into. And it's important to note, and we highly recognize in the Ministry of Health, that we have 17 cadres, and all these cadres all come together magically to take care of us. And so there's no favoritism for any one specific cadre, and all cadres who are working as a team will be able to be facilitated with a welfare package. Perhaps, DG, at this point, you can highlight further on the issue of drugs and the trials that we are doing, and also emphasize a bit more with regards to COVID in other medical conditions.
Thank you, Madam CS. In terms of the clinical trials that are ongoing, I remember we discussed this at length 2 or 3 days ago. Based on what is happening in other European countries, in Americas, regarding compounds that potentially could be able to treat COVID. And I'm glad to inform you that through the World Health Organization, Kenya has received approval to join the Solidarity trial, and we have already obtained ethical approval. The compounds that we are going to deploy, of course, will depend on how available they are, how easily available they are in terms of compassionate use of the different drugs and protocols. And of course, it will also depend on the clinical presentation of our cases. As we all know, majority of our people tend to have a mild form of the disease. So if we are to go for very expensive compounds, which we could be able to apply for very small segment of the population, then we'll have to be able to make that judgment based on the numbers. But there are a whole range of compounds, antivirals, antiretrovirals, antimalarial drugs, which will form part of the arsenal that we are going to deploy to see what works best in our scenario. We have also gone ahead to develop guidelines and standards for all conditions, so that in case you have COVID in pregnancy, we have developed guidelines and protocols which we have shared with our teams in the counties for easy application. And of importance is this issue of the children, because in today's press, we told you of a child who is just 6 months old who has tested positive. Most of the children tend to be totally asymptomatic. And because children tend to play with other children, they are potentially very, very good transmitters. So the message today is to ensure that you limit interaction between your children and others, and also ensure that children also undertake infection prevention control measures, including hand washing, using sanitizers. There are even children's face masks now in the market locally, and of course practicing physical and social distancing. I just wanted also to emphasize on the issue of the refugees. You know, Kenya, we have hosted refugees over very many decades, especially from our neighbors in Somalia, Ethiopia, South Sudan, the DRC, Congo. And most of the refugee camps that we have, of course, are located along our border areas. And remember, our borders are porous, like if you go to Dadaab. And the infection now in Somalia, the numbers are increasing, and because of that ease of movement between Kenyan side and Somali side, that is why we decided to make a restriction in movement in Mandera County. Further, we have also started testing in Wajir County to be able to cover that northeastern part so that samples don't have to be brought to Nairobi. We have also enhanced our surveillance capacity in the refugee camps together with our partners, including UNHCR, World Vision, the Red Cross, AMREF, and all other players. Of course, capacity building is ongoing for healthcare workers who serve the refugee population to be able to assist them in case definition. And of course, we continue with our advocacy, community social mobilization, so that we have the refugees as part of us in the fight against COVID-19 disease. Thank you.